Hi, I'm Matt Lambert. Welcome back to another episode of AHN Prehospital Care Assessments. Today with me we have Mike Taramelli, who is the Forbes Trauma Program Director here in Monroeville, part of the Allegheny Health Network. Hey Mike, how are you?
Good, Matt, how are you?
Good, very good. And talk a little bit about you, your career, and a little bit about the Forbes Trauma teams.
I got my start as a firefighter EMT. My senior year of high school, I went into an EMT program with my friend, ended up becoming an EMT, got involved with the fire department in my hometown, did that for about 6 years, held a couple different officer positions with the fire department before I graduated nursing school. When I graduated nursing school, I worked as an ER nurse at a trauma center on the eastern part of the state, moved to North Carolina for a little bit, and was a ER trauma nurse down at one of the trauma centers outside of Charlotte. And then from there became a supervisor and ultimately ended up here at Forbes with the trauma program and in my current position.
All right, Mike, can you tell me a little bit more about the Forbes Trauma Program and how we've grown since October of 13 when we started?
The growth and the transition of the Forbes Trauma Program has been absolutely incredible. And the fact that I got to be part of that from pretty early on was something I've enjoyed. As the only level 2 trauma center in Pittsburgh, I think one of the things we had to prove to everybody was that we could handle the same type of injuries that the level 1 centers can. And I think over the years we've been able to prove that. We've made a lot of improvements and additions to make sure that we have the capabilities to care for the most severely injured trauma patients. We have achieved top decile in trauma patient outcomes from the American College of Surgeons Trauma Quality Improvement Program, demonstrating that trauma patients that present here have compared to all trauma centers across the entire country, that our outcomes are in the top decile. And that compares us to all level 1 and 2 trauma centers across the country.
All right, Mike, let's talk about a few myths that the EMS providers may have in the community. And a lot of that revolves around the difference between a level 1 versus a level 2. And does that difference really affect the patient care provided by these different facilities?
Level 1 and 2 trauma centers in Pennsylvania are required to have the same surgical capabilities. So there's no differentiation there. And actually, the more severely injured the patient is, the more important it is to get them to an appropriate level trauma center as quickly as possible.
So I think another myth would be, I arrive on scene, I have from my perspective, a severely injured patient. Am I going to want to bypass a level 2 trauma center to get to a level 1? Does picking these trauma centers have anything to do with severity?
In the severely injured trauma patient, our number one focus has to be getting surgical control of the hemorrhage as quickly as possible.
Right.
And that's why we're out here in the East, is so that the patients of Eastern Allegheny County and Westmoreland County can get to surgery faster. Pre-pandemic, when there was, we know what the traffic's like on the Parkway. So there was definitely a need for, a trauma center out here in the eastern suburbs so that the patients have quicker access to definitive level trauma care. So to bypass the closer trauma center to get to another trauma center would actually just be, contributing to a lower probability of survival.
Right. So it really is the same standard, the golden hour.
Yes.
It's still all about time.
Yes.
Injury to trauma.
Yes.
Surgery.
For a trauma patient, there's no patient that needs to be triaged directly to a level 1 if the level 2 is closer.
So another myth around the EMS community is that if you take your patient to a level 2 trauma center, they're just going to end up being transferred to a level 1 down the road. Is there any truth to that?
Right. So level 2 trauma centers are not stabilizing centers. Those are your level 3s and 4s. So for level 2 trauma centers, like we just talked about, we're required to have the same surgical capabilities as level 1 centers. So we are allowed to transfer low volume patients, so patients that we don't see very often. The only 2 patients that fall into that criteria for us are patients with eye injuries that actually require reconstruction of the globe, or hand injuries that need microvascular surgery. We don't see that many of them, so we do transfer those patients out. But all of the life-saving capabilities would be done here first.
So talking about the essence of time, there's a myth that, maybe I need to call a helicopter or wait for these advanced procedures.
So the data actually supports that trauma patients actually have better outcomes when they receive BLS-only care. Now, the question is, why is that, right? My assumption and thought process there is that we know that the more procedures that you do at the scene, the longer the patient's at the scene. So it's not that the advanced interventions are bad for the patient, but the fact that we're doing them in place of rapid transport is where we start to see a decrease in probability of survival. So our focus has to be on the rapid transport to the nearest trauma center, and all of those advanced procedures have to be an adjunct to rapid transport instead of a substitute.
Right.
And even if we're requesting those resources, we need to be still moving forward, right?
Mhm.
We shouldn't wait on seeing 20 minutes for those resources when we could be 20 minutes closer to our destination.
All right, rendezvous.
Right.
So
Absolutely.
Always a good idea. Well, Mike, thanks for having me here in the Forbes Trauma Bay.
Absolutely.
It's been good seeing you.
Good to see you.
Well, thanks for being here today with me and Mike. Please like us on Facebook and subscribe to our YouTube page, and we'll see you next time on AHN Prehospital Care Assessments.